Hey guys, in this video I help you with one of the most confusing concepts in anatomy class, and that is the anatomical directional terms. So let's get started. Anatomical directional terms are used to safeguard against confusion between medical providers. When numerous medical providers are using the same language to describe body structures and injury locations, the opportunity for confusion is diminished. The main key point I need you to understand is that many of these terms are associated with a point of reference on the universal anatomical position. As that point of reference changes, so may the term associated with it. The universal anatomical position is where the body is standing upright, facing forward, with the arms at the side with palm facing outward, and the feet are flat on the floor, also facing forward. The first pair of directional terms are superior and inferior. Superior references toward the head or the upper portions of the body, whereas inferior refers toward the feet or the lower portions of the body. For example, using the pelvis as a point of reference, we can say the neck is superior to the pelvis, where the knee is inferior to the pelvis. The next pair of directional terms are anterior and posterior. Anterior is referring to locations at or near the front of the body, whereas posterior refers to locations at or near the back of the body. For example, using the sternum as a point of reference, we can say that the sternum is anterior to the heart and the lungs are posterior to the sternum. The next pair of directional terms are lateral and medial. These two terms are in direct reference to the midline of the body. The body's midline is an imaginary line drawn through the center of the body, dividing it into two equal left and right halves. Medial meaning closer to the midline, where lateral is meaning farther away from the midline. For example, using the right hand as a point of reference, we can say the pinky finger is medial to the thumb and the thumb is lateral to the pinky finger. The next pair of directional terms is proximal and distal. These terms are directly related to the appendicular body, or the body's appendages, including the pelvis. Proximal refers to a location nearer to the structure's origin. Distal refers to a location farther away from the structure's origin. So for example, if you are using the left arm as the point of reference, then the point of origin would be the left shoulder, whereas the right hip would be the point of origin for the right leg. So using the right knee as a point of reference, we can say that the femur is proximal to the knee and the ankle is distal to the knee. The last pair of directional terms is superficial and deep. Superficial refers to a location closer to the surface of the body, whereas deep refers to a location further away from the surface of the body. For example, using the layers of the skin as a point of reference, we can say the epidermis is superficial, whereas the subcutaneous tissue is deep. Always remember that these terms are in reference to the universal anatomical position and may utilize a specific point of reference on that anatomical position. Well guys, that's it for today's video. Stay safe out there and I will see you in the next video.